Well, hey there, Careblazer. Welcome back. I recently received a question from a Careblazer that I just thought was such an important question, and I think a lot of you will be able to benefit from it. Basically, this Careblazer wrote in and said that she had taken her mom to her primary care follow-up appointment. Her mom is in her 80s and has moderate dementia. Within that primary care appointment, the doctor reminded the daughter that her mom was overdue for her mammogram and colonoscopy. Now, this Careblazer wrote in asking, at what point do some of these medical tests become unnecessary? Although we want to make sure our loved ones with dementia get the best possible care and that they're following up with their doctors and things are being looked at, we also don't want to put our loved ones with dementia through any unnecessary testing. So I think this is a great question. And in this video, I'm going to go over specific guidelines from various organizations in terms of what they say about age limits and testing with regard to mammograms and colonoscopies and prostate cancer screenings. I'm also going to share with you the one question I would recommend you think to yourself before you decide whether or not to put your loved one through some of these medical procedures and screenings. Before I get into that, I just want to take a quick moment to thank everybody who's joining us that's brand new. If you are new to Careblazers TV, welcome. My name is Dr. Natali. I'm a board-certified geropsychologist, and this is the place where we talk about everything dementia. Hit the red subscribe button and be sure to download your own Careblazer survival guide. The link to it is for free. It's below this video in the description. All right, now let's get started. Now, I feel it's very important for me to mention, because I'm talking about medical guidelines and screenings and tests, this is true for all of my videos, but I really want to highlight it here. It's important that you are talking to your loved ones' healthcare providers, trusted healthcare providers, about specific recommendations and things that you should be doing for your loved one with dementia, or their recommendations for what your loved one with dementia really needs. So, although I'm not giving you specific medical advice, I do want to share some things for you to think about when you start to be faced with putting your loved one with dementia through some pretty distressing medical procedures and screenings, okay? Now, for this video, I did quite a bit of research. I went and I looked at different medical organizations' guidelines for what they recommend in terms of age limits and testing. And I can't say I'm really surprised. All of the organizations were pretty good and pretty clear in terms of when to start these procedures, but they weren't very clear and sometimes didn't address it at all in terms of when to stop these procedures and routine screenings. I'm not that surprised. A lot of these procedures and screenings were made with younger adults in mind, not necessarily the oldest of the old, and they certainly don't mention anything specific like people with dementia who would have more of a challenge getting to the hospital and being able to tolerate some of these procedures. It's just another example of how much our society really has to improve if we're going to provide adequate and justified care for our loved ones with dementia. But my rant aside, let's get started. Let's start with mammograms. So I took a look at the guidelines for when mammogram screenings are typically started and when they should stop. Now, there's a lack of information regarding how effective it is to screen women over 75 years old, regardless of whether or not they have dementia. But the recommendation here is that the decision to get a mammogram for women who are 75 and older should be an individual decision, keeping in mind the following three factors. Number one, a person's life expectancy. Number two, their functional status. And number three, their goals of care. So here we have a lack of evidence regarding how helpful a mammogram would be starting at 75, but they don't necessarily give a cutoff, and they basically say keep these factors in mind. Now, what about colonoscopies? The American College of Physicians, they took a look at all the different guidelines out there that exist for recommended colonoscopy guidelines. And what they found is that, or what they came up with their final recommendation is that colonoscopy should be stopped for routine screening at the age of 75, or screening should be stopped in adults with a life expectancy of less than 10 years. Now, regarding prostate cancer screenings, there was a lot of controversy on this one, with different groups feeling like there should be no routine prostate cancer screenings, and groups that believe that prostate cancer screening should be started at the age of 40. Now, there were no specific guidelines in terms of an age cutoff or of when prostate cancer screening should be stopped. However, this group was pretty similar to the colonoscopy group in that their final recommendation is that if a person's life expectancy, again, is 10 years or less, then they recommend that prostate screenings are unnecessary. Now, since these guidelines, like most medical guidelines out there, are made and created with the younger, more healthier, average older adult, it doesn't really specifically address a lot of this unique challenges that come for older adults with dementia. So when it comes to routine screenings for your loved one, it is a conversation to have with your loved one's healthcare provider, to talk to them about your concerns, to talk to them about how your loved one would be able to tolerate the procedure and any sort of effect it might have on them after they go through it. So definitely a conversation for you to have with your healthcare provider or with your loved one's healthcare provider. Now, are you ready for the one question I recommend you ask yourself before you and your loved one consider whether or not to go forward with a healthcare procedure? If your loved one goes through whatever medical testing or procedure is in front of them, what would you do with those results? Would anything change about your loved one's care based on those results? If the answer is no, then you might want to think twice about putting your loved one through a potentially distressing situation for no real reason. Let me explain the situation let me explain the specific example so hopefully it might make some sense. Let's say, for example, your 86-year-old mother with moderate dementia is due for mammogram screening, and your mom's healthcare provider is suggesting that your mother go forward with her mammogram screening. What would you do if that screening result came back positive for cancer? Would you consider putting your mother through radiation, chemotherapy, or surgery to help get rid of the cancer? If the answer is no, that you would not want your mother to go through any aggressive treatments at this stage in her life, then what really is the point of going through the screening? Let me give another example, and this one's quite common. Let's say your husband with vascular dementia is at the neurology appointment, and you're wondering and you're asking the neurologist how far his dementia has progressed. Now, the neurologist could put in a scan to scan the brain and see what shows up on the imaging. That might give you an idea of if it's progressed. However, what would you do with those results? Sure, it might satisfy some curiosity and it might be interesting to know if the brain scans have showed progression. However, are you going to change anything at all about the treatment? Is it going to change anything at all about how you care for your loved one with dementia? If the answer is no, and that it just simply might be interesting, again, you might want to think twice about putting your loved one through something like that. Now, I do want to stress that these guidelines, and my own personal opinion, is that whether or not to put your loved one with dementia through various medical procedures and tests, it has really nothing to do with the age, the exact age per se, but it has so much more to do with your loved one's functional status and their life expectancy. There's nothing magic about a certain age that makes somebody unable or more difficult to handle a medical procedure. However, if you have somebody who you feel is towards the end of their life or really struggling just to even get through their current life when everything is normal and they're at home, is it really worth it? Is it really something you want to do to your loved one to put them through some of these medical procedures and tests? I know, actually, right now I have two patients, one 98, one 99, and they are rock stars. They're doing awesome. Going for walks, daily exercises, they're doing really, really great. Now, maybe there would be some sort of test out there that they would want to pursue, and since neither one of them seem to be hitting any roadblocks or slowing down at all, that might be completely appropriate. However, I also work with some 65-year-olds who are really struggling, who can barely walk, who can barely move, whose memory is really bad. And so that might be somebody that, even though they're below the 75 age cutoff for, let's say, a mammogram, they might still be somebody that you would wonder, well, what would I do if those results came back positive? So again, don't get hung up on the age. I don't think it's a healthy thing for us to deny people of a certain age certain medical tests. I don't want to give that impression at all. However, I do want to encourage you to take a look at the whole picture. How much life does your loved one have left? Are they going to be able to tolerate this procedure? And if so, would you change anything at all based on those results? As with most things, it's really about balancing the risk versus the benefits. And that's something that you have a conversation with your loved one about, you have a conversation with your loved one's doctor about, and if your loved one's to the point where they can't really engage in the conversation, then that's just a decision you make, trying to keep in mind what you think your loved one would have really wanted if they were able to make this decision for themselves. Now, I also want to stress that this video is really about routine screenings, routine procedures in older adults with dementia. It's not talking about procedures or screenings or tests that are being recommended because your loved one is showing a new symptom or having a sudden change. There might very well need to be something that has to be done. A classic example is if your loved one all of a sudden is having a big behavior change or a big memory shift, that could be a sign of a UTI. By all means, let's get that urine tested and let's have the doctor take a look and see if maybe there's a treatment that needs to be done, right? So I'm talking about the kind of routine things, the checklists that sometimes are recommended just because that's what you do every year or every other year. So that's what this video is really all about, not about addressing any new symptoms or changes. What do you think, Careblazer? Have you ever had the experience of putting your loved one through a routine medical screening or a routine medical procedure, only to find yourself wondering, what was the point in this? You know, you can even stretch it as far as some routine medical follow-ups, depending on the specialty or the provider. If you're like some of the Careblazers I know, you may have struggled with getting your loved one dressed, bathed, getting them into the car, getting them to the clinic, meeting with the provider that wants to meet every so often, just to find yourself like, what was the point in this? What did I get out of this appointment, right? We want to avoid unnecessary stress for your loved one with dementia. We also want to avoid unnecessary stress for you. You do not need any more of that. So that's the whole kind of mindset and goal around this video. Have you ever found yourself in a situation like this? What do you think about this question about asking yourself, what would you do with the results? Would you change anything? I hope that this has been helpful to you. I'll be back next week with a new video. In the meantime, hop on over to the Careblazer community Facebook page and the Facebook group within that page so you can connect with other Careblazers in similar situations. There's a lot of support waiting over there. All right, Careblazer, I'm wishing you all the best. Keep up the great work. Bye.